The sense of sight is perhaps the most important function that helps humans to perform duties as living beings. When sight is impaired, movement and the general organization of life activity becomes difficult. Unfortunately, many people do not give priority to the proper care of their eyes by adopting lifestyle practices that support a strong sense of vision. The situation is even worsened by the scarcity of specialist facilities providing quality care for eye conditions and giving the right education and support to citizens to be conscious of the need to take good care of their eyes. 4th July 1987 was a turning point in quality medical care for the eye, especially for the people of the central and western regions. The Christian Eye Center was commissioned at Abum Wells Road in Cape Coast as a facility dedicated to providing comprehensive eye care services before moving to its current site in 1992. To honor the memory of the first bishop of the Anglican Diocese of Cape Coast, Right Reverend John Alexander Ackon, whose initiative it was that had seen thousands receive quality eye care many years down the line, the center was renamed the Bishop Ackon Memorial Christian Eye Center in May 2000. Very Reverend Daniel Kwesi Esel was around in the foundational years of the center and walks us through its history.
The Bishop Ackon Memorial Hospital was the brainchild of Bishop Ackon, who at one time on one of his travels outside met an ophthalmologist called Dr. Winter. They got into discussions during the flight and other things. And when Bishop Ackon knew or got to know that the doctor was an ophthalmologist, he started working whether it was possible for him to affiliate with the Anglican Church in Cape Coast and to set up an eye center which will serve the church and also the community. The whole program that was brought into Cape Coast through the Anglican Church was Christian Eye Ministries. In fact, it was one of the very first eye clinics or centers that were established, even in Ghana. As time went on, they realized that it was better for the eye center to have its own premises, to have its own clinic, buildings, and so on.
Founded as a social ministry of the Anglican Diocese of Cape Coast in partnership with the Christian Eye Ministry, the center has gone through many phases, chalked milestones, and becoming one of Ghana's leading eye care facilities. So how has the center evolved? What has been some of its major achievements? And what are the prospects for the future? Reverend Canon J.W. Kofi de Graaf Johnson is the principal administrator of the center.
When I joined the facility, our end of year OPD attendance was just a little over 10,000. As at the end of last year, we had gone close to 19,000 OPD annual. Now, the sharp increase in the attendance can be attributed to a number of factors. 1, improvement in service delivery. 2, improvement in customer care. And 3, the type of equipment that we have brought in to improve efficiency and effectiveness of care. Apart from the University of Cape Coast acquiring an OCT machine recently, we were the only facility that had an OCT, which is basically for glaucoma diagnosis. People are beginning to appreciate the difference between the services we provide here and the services they get at an optical shop. The difference is that over here, when you come, you go through the whole range of eye care services, as against an optical shop where you only go through a refraction process and then you are given the glasses. Sometimes you may not need the glasses. If you look at our top 10 morbidity cases, that's the top 10 cases that we see here, most of them don't require glasses. There could be disease conditions that could affect the vision. So once the disease condition is cleared, then the patient doesn't need the glasses. But if the person goes to an optical shop, then the person will be given a glasses, but not treating the cause of the error that is being observed.
Last month I'm ben was a kuna yinti ndeda so wabaya cross nyame na dum ndeda so me be me so wa ya ma mewi ma magidase wa nyame me de ebie ni na waye wayɛ ama.
We used to have one consulting room and one room for explanation, but now we have 3 consulting rooms, all well furnished and equipped. We have the first floor, which is completed, and that will free a lot of space for additional services to be offered. Ultimately, we are looking at adding other services to eye care in the facility. Thanks to Compass Road Society, who visited in 2013, decided to help us. Again, thanks to Help is on the Way Ministries, they have helped us to acquire most of the equipment from the US to retool the entire center. There's also been tremendous improvement in our manpower. Now we have a lot of qualified general nurses and ophthalmic nurses. We are training our own ophthalmic nurses. So currently now, this center is a training center for interns from the Ophthalmic Nursing Training School, Kolebu, Optometry Department, UCC, Optometry Department from KNUST, students from the Oyuku School of Optician, and in recent times, the Marriott University in Nigeria. There were 2 interns who came here for their external partnership with us. We are working with the Optometry Department of UCC to also receive students from Ireland. And looking forward, we are looking to expanding further and farther.
The Bishop Ackon Memorial Christian Eye Center now stands as a beacon of hope for many persons seeking quality medical care for their sight.
A friend mentioned Christian Eye Center to me, and then I started going there. And I can say that ever since I went there, I haven't regretted, because I had a first surgery in Takoradi, and it gave me problems. So when I came to the Christian Eye Center in Cape Coast here, it was detected and it was corrected. They even noticed that there was another growth on the other eye, and then they rescheduled me for the second one a year after. Since that time, in fact, things have improved, and I only go there for review or for checkups. That's all.
To understand the kind of cases that are handled, Principal Optometrist Dr. Parkwesi Finn Hope helped us with a profile of cases normally reported and diagnosed. He also shared some insight on what can be adopted as good eye care practices.
We do have a lot of children coming in, and when kids are coming in, a lot of them are coming in with allergic reactions, allergic conjunctivitis. We have a lot of cataract cases and then glaucoma cases. And of course, there is refractive error, which is also high on the list. These are the 4 main cases I think we keep seeing constantly. And as to how clients can do well to spend within their means, it's better we prevent cases from escalating than waiting for them to escalate before you spend so much on the management or treating the case. So we are better off engaging in good health practices. If we have any symptom or any sign of any condition, you quickly report to the clinic, and when we see it early, chances are that before it develops, it becomes a full-blown condition, you have to spend less. But if it becomes full-blown, you might spend more over a protracted time. And then you engage in good practices, you eat healthy, you eat fruits and vegetables to preserve vision, and I'm sure you'll be spending less over time on your eye.
The first and most important pillar to the success of this center is God. The second has been the strategic partnerships it continues to create with not-for-profit organizations worldwide who have always believed in the cause of the center and made resources available. One of the most enduring partnerships has been with the Help is on the Way Ministries, a not-for-profit organization headquartered in California, USA. Help is on the Way continues to support the center in its shared vision of bringing quality eye care services closer to everyone, and this support is best exemplified in the person of Dr. Chris Carlin, an ophthalmologist and social minister who in the past 24 years has been offering his skills and expertise to the center as a consultant ophthalmologist.
There are great ophthalmologists in Ghana, and we're utilizing them in the Christian Eye Center here now. The nursing is excellent. The technicians are dedicated. Everybody got the same goals. And it is very similar to the place where I work in California, where we have a team that is committed to doing the best job we can do with the materials we have. That's what we have here. So that keeps me coming back. And then the other thing that keeps me coming back are the patients. Watching how happy they are the day after surgery, they go from being blind, frequently blind in both eyes, to the point where the next day they could see well enough to sometimes drive a car if they were able to drive a car in the first place. In other words, their vision was now good enough, even in many of them one day after surgery, to be able to be functional again. And it's not just for that person. You have to think about it previously being a burden to the entire family. Now, I still do go to other countries, but I feel most comfortable and at ease here. The vast majority of people, in the patients that have cataracts and the rest of their eyes exam is normal, I would say that 90% of them do well.
Dr. Carlin's contribution to the Bishop Ackon Memorial Christian Eye Center has been exceptional. As a befitting tribute to this, a plaque was mounted and dedicated to him by the center.
Very, very rare for me to be without words, but this has touched me so deeply, I can barely speak.
Just as Dr. Carlin represents strong partnership with expertise, the dedication of other staff represents the collective commitment of the center to excellence. On a daily basis, ophthalmologists, opticians, optometrists, ophthalmic nurses, and other professionals, supported by a strong administrative staff, place the patient at the heart of their work as they attend to hundreds of them who come in.
Because of the success stories, we have a lot of people coming from Western region, even outside Ghana, as far as Ivory Coast, coming here to receive treatment. And we also have a lot of equipment to help diagnose every kind of eye disease.
The Anglican Diocese of Cape Coast continues to manage this facility to serve its many patrons, and the Bishop of the Diocese speaks of what this project means to the Church.
As the Bishop, even though I did not start this center, I'm so proud that the Church has managed and still managing to contribute our quota to the healthcare policy and program in the country. The fact that people have received their sight through the center is nothing but ministry to humanity.
The vision of Right Reverend John Alexander Ackon, the contribution of succeeding bishops, the dedication of staff and partners of the center, and the support of the Anglican Church has made the Bishop Ackon Memorial Christian Eye Center an example of how the Church can contribute to quality healthcare delivery in Ghana. So, if you seek eye care services or have a friend or relative who seeks one, you may consider a trip to North Ola in Cape Coast, where one of Ghana's finest social initiatives in healthcare is located, where you will find the Bishop Ackon Memorial Christian Eye Center.